Hi everyone, welcome to Self-Balance Live. I'm Szenan-Balance from Self-Balance, the acupuncturist. Now, today's topic, we're going to talk about coronary artery disease, which we're sorted as CAD, coronary artery disease. Now, we're going to talk about what is the cause of it, and we're going to talk about the symptoms of it, and we also want to talk about the risk factor of CAD. Now, in the end, I'm going to introduce you some acupressure point or acupuncture point for coronary artery disease, right? Okay, let's start with the, let's give you an overview, okay? So coronary artery disease causes impaired blood flow in the arteries that supply blood to the heart. We know what heart do. Heart is pumping up all the blood with nutrients and oxygen in it, and to the entire body, or all the tissue, all the organs, right? We can't go without heart. As soon as your heart stops, then your life stops, right? Now, then heart supply all the blood to the entire body. Of course, heart supply the blood for itself as well. So there are 4 arteries that actually supply the blood to heart itself, okay? So if those arteries blocked, then that is what we call the coronary artery disease. So there's another name called coronary. You may not heard about the artery disease or coronary artery disease. You may heard about coronary heart disease. It's the same thing. It's actually the same thing, right? So we put it in CAD, okay? CAD will be easier for me to talk about in this time. Okay, CAD is the most common form of heart disease and affect approximately 16.5 million Americans over the age of 20. That's huge. You know why? That's because the diet, what they eat, the food is wrong, right? So that causing a lot of people get CAD, coronary artery disease. Hi, Carol, how are you? Now, so a heart attack can come from uncontrolling CAD. So it's important, as soon as you know you have suffered from CAD, you need to change your lifestyle, or you need to get treatment properly. All right. Okay. Let's talk about the cause of the coronary artery disease. The most common cause of CAD is vascular injury with the cholesterol plaque build up in the arteries. So what that means is, let's use my hand. So that is the artery. So if the cholesterol plaque build up inside and it becomes smaller and smaller, the artery becomes smaller and smaller, so the blood flow can't go through it, or it goes less and less, and it build up more and more cholesterol plaque. Then it may fully blocked in the end. Therefore, there is no blood supply into your heart. That's how it causes it, right? That's how it causes it. So really, you need to lower your cholesterol. You need to control it. So we know that the diet is the main thing that causing the high cholesterol. We talked about it in before, right? And we talk about one of the surgeons in America, that he's 100 something, and he, after surgery, he helped a lot of people get surgery and for the heart, you know, and he always tell them that the only thing that can help you is your diet. you need to change your diet. Otherwise, this will happen again. You get bypassed, it happen again. All right. So let's talk about the symptoms. Okay, the symptom is when your heart doesn't get enough artery blood. What is artery blood? Artery blood is the blood in the artery going to you. So and the artery actually just getting fresh blood and nutrient and oxygen is in the blood. All right. So if you haven't got enough blood into your heart, and you get what is symptom we heard a lot is angina, which is chest discomfort symptoms, right? So angina is the most common symptoms. Is chest discomfort, pain, tight, all this discomfort in your chest, and this is because lack of blood into your in your heart. That's because of the CAD, the artery blocked up. You couldn't get the blood. Okay, so chest pain. Yes, chest pain is common in this case. Hi, Kika, how are you? And heaviness. Your chest feel heaviness. You know, so heavy in your chest. There's another symptom. It may not be pain. It's just heavy tightness. All right, can be the symptoms, or tightness, and it can be burning sensation, or something squeezing your chest, you know, something squeezing your chest. But when we say burning, right, burning, so that you need to as a practitioner, we need to understand that this symptoms can also be mistaken for heartburn, because the burning and indigestions, right? So we always ask, is that because of eating certain food that causing your heartburn, causing discomfort? If that is, then it will more likely be with the stomach problem, heartburn issue, not the heart one, not from the heart, okay, not from the artery, okay. So we have to ask more questions and do more tests to be able to tell this. Okay, so other symptoms of the CAD, okay, it may be pain shooting down to the hand, to the shoulder, to the arm, okay. So it more likely be on the left side, okay, more likely on the left side, okay. And shortness of breath, like you can't breathe properly, and sweating, okay, and dizziness, you know, because you haven't got enough oxygen and blood into your heart, okay. You may experience more symptoms, okay, when your blood flow is more restricted, which means if the artery has been blocked a little bit, you get discomfort. But when it block more and more, less and less blood flow is to supply to your heart, you get more and more symptoms and more severe, okay. If a blockage cut off blood flow completely or almost completely, your heart muscle will start to die if not restored, okay. This is a heart attack, you know, cause heart attack, right? So don't ignore any of these symptoms, especially if you are you know you have this problem. Then you need to take action to get someone to look after you, and to get acupuncture done, and to change your diet, to take Chinese herbs, and we help patients to get rid of all the symptoms and change the diet, and you can actually reverse those things. You know, you can actually reverse those things, and there are a lot. One of the great book, the China study, and it has a case in one of the doctor in America. He actually a surgeon. You know, he have a lot of patients, cut out the chest and help them to do bypass of CAD. And when he suffered from it, he was so nervous. This is a real case on the China study books, and it Dr. T. Campbell talked about this, and he was so nervous. And what happened is he called Dr. T. Campbell, and Dr. T. Campbell told her that, hey, you just need to change the diet, you know, and he got about, I think he about fully blocked. At that time, it's probably just 1 or 2 that left that is still healthy of the artery. We have 4 arteries that supply to the heart, and then Dr. Campbell suggests him that, well, change your diet, because he know the medication and the surgery won't help him, because he is the one that give patient surgery. He know it wouldn't help. So he was so nervous, and since he became vegan, changed the diet, and after a few months, he got checked again. A lot of it unblock itself, you know, about 80% unblock itself. Unblock itself, so you can reverse it. You can reverse it. Definitely, you can reverse it. And I didn't say that. It's the China study. So this is a great news, you know. You really want to know about it. And I got something in the mouth. I think it's one of my hair. So this book is a great book, the China study. And if you really want to understand what causing the disease, what's the best diet for you, and I would recommend you to read it. Simple, the China study. And I'm sorry, it wasn't written by Chinese people. It's actually American doctor, a nutritionist. Right? It's a great book, and I love it so much. So I would like to introduce to you about this book. Hi, happy day. So symptoms. So that there's something that we need to talk about is CAD. When it happens in women, it can be different. The symptom can be different. All right. So women may also experience the what we just mentioned, those symptoms above, but they are also more likely to have nausea, vomiting, back pain, upper back pain, right? We're talking about upper back pain, not lower back pain, all right? So upper back pain. And some patients get pain from the chest. As soon as they get pain in here, they shoot over to the upper back, or on the upper back, and a little bit go to here, right? And they can feel it. They feel pain in here or upper back at the same time, like something that from here to there to here, and that is pretty sure that is heart problem. Okay. Jaw pain, no? It's very rare. Jaw pain up here and jaw, okay, or neck pain. It can be neck pain as well, right? And shortness of breath without feeling chest pain. Sometimes they can't breathe, but without feeling any pain in the chest, right? Okay, let's talk about the risk, the risk factor of CAD. So what's the risk factor? So understand the risk factor of CAD can help with your plan to prevent or decrease the likelihood of developing the disease. So we understand why do you want to understand why is it so important? Because we need to understand what causing this. If we understand what is causing the cholesterol plaque develop in the arteries, then we can reverse it. We can stop all this thing that the risk factor that or when you suffer from it, you need to stop all this. You know, if you check out you have CAD, then you have to stop all this actions. If you don't change the action, you're never going to heal it. You know, so this is important. So one of the symptoms, high blood pressure. We talked about high blood pressure the other day, and those acupressure point is good for managing the high blood pressure, and you really need to find out what's causing high blood pressure. If you are just trying on medication to control your high blood pressure, I'm sorry, I don't think it will prevent CAD, because you're just controlling your high blood pressure. You're not actually get rid of your high blood pressure. Remember, high blood pressure is just a symptom, it's not a disease. It's something causing the high blood pressure. You need to reverse. You need to fix your high blood pressure, and you need to find out the reason for it. Okay, so this is important. High cholesterol levels. We know the cholesterol level is high, then it build up what? The plaque on the arteries. when it build up the artery and the blood can't go through. So yes, of course, we need to get the cholesterol level down. And how do we do that? What's the best thing to do it? Vegan diet. Has been proved. It has been proved. And I have patient that I have friend that they just changed vegan diet and for 1 or 2 months, I think, then he fixed his cholesterol. You know, you don't. People think that go for exercise and run, and it can help the cholesterol. Yes, it can, but not as strong as changing your diet. This is truth. Okay. Insulin resistance, which is diabetes problem. Yes, diabetes. What causing diabetes? The diet. Type 2 diabetes. We're not talking about type 1 diabetes. Insulin resistance is type 2 diabetes. There's type 2 diabetes, and type 2 diabetes is because your lifestyle, your diet. So you want to get rid of this, and that it won't form to your heart problem. Obesity. Again, obesity is a diet problem as well. And inactivity, like you don't move a lot, you don't exercise, you just sit there too much, and that is unhealthy. Okay. Unhealthy eating habits. And here we talk about that. This diet, a lot of junk food, sweet, that's not good for you. And emotional stress. Emotional stress, that talk about in Chinese medicines. In Chinese medicine, emotional stress, work stress, work too hard, family stress, and you need to control all this. Excessive alcohol consumptions, too much alcohol. Get rid of alcohol if you want to live healthy. Simple. I think simple for me because I don't drink, but for other may not be simple, right? May not be simple. Okay. That's it. This is something that we want to talk about. Oh, I got someone here. Hi, is Soka from Hungary, medical doctor and acupuncturist. That's great. We have doctor over here. That's good. Okay, great. Now we're gonna talk about the acupuncture and acupressure point right now for CAD. Right. Just for CAD, the symptoms, we just treat the heart because the artery is actually around the heart. It's not out of the way. It's just around the heart. It's the artery that blocked out. But I want to tell you this: acupuncture can help the symptoms, definitely. But what is the proper way to get rid of it? Changing diet. I won't tell my patient. To be honest, I won't tell you if you are a patient who suffers from CAD or if you're an acupuncturist right now in here. I won't suggest you just tell the patient to come to you, take the Chinese herbs, and having acupuncture or acupressure. That's it. No, this is not the right way to do it. Acupuncture, acupressure, Chinese herbs can help the organs imbalance. It can reduce the symptom, improve the blood circulation. That is for sure. But we know the fact is the cholesterol plaque that on the artery, it built up the cholesterol plaque. So we need to control the cholesterol. We need to reduce the cholesterol level. And what is the proper way? If you think that the proper way is just getting some treatment, that's it, and the patient think that way, if you have the concept like this and the patient think about that way too, you're not going to successfully help the patient at all. You're not going to successfully help the patient. You help them to decrease the discomfort, and you want them to change the diet. That is for sure. And you have to have your knowledge to suggest the patient. And I tell my patient, I write down to them, this is the book, and we have a video about diet, talk about diet, and we send the video to the patient. You need to Read this, and you need to change your diet. This is for sure. If you just want me to control the symptom and you don't want to get fixed, you don't want to get better, I will be able to, as soon as I put needle in, you feel very comfortable over here, you know, you feel comfortable, but it definitely will come back. So do it properly. What is the best diet for CAD? Vegan diet. Vegan diet is the best diet for CAD, right? So there's a book, Happy Day, the China study is the great book that I will introduce you. Any doctor, any practitioner should read this book, you know. So I always suggest patients when it comes to heart problem, you must change your diet, right, to work it properly. Then because they still need your help because they are in pain, they're very uncomfortable, they feel sick, they have no idea what's going on, and they want to get better, but they're very sick and they're medication, and medication doesn't actually help them reduce a symptom, or something that actually help them, but they're still worried. They're still worried. They don't know when they might sleep for a while, and then it in the middle of the night, and it happens. So you want to. They have medication. They will call. They'll call the emergency as soon as they happen at nighttime. If the medication doesn't work for them, or if they run out, they will call. But in the meantime, you need to show them this point over here so they can help themselves. Anything will do, you know, so they can help themselves. So how do you get to this point? We show them on chest pain already, but I want to show you it's totally the same point. It's called Nai Gong Nei Guan, pericardium 6, right? So this is how you locate the pericardium 6. 3 finger from here, from the wrist down to here. So on this level, so 2 between the tendons, and between the tendon, there is a point between tendon. So get to the point and rub it. If you have the pain, if you suffer from the pain, get to the point, rub it hard. Okay, don't worry about getting bruised in here. But if you haven't got the pain, or you just get tightness, it's not as severe, that you just rub it there, get the tenderness spot, and rub it for 1 minute. 1 minute. You want to do it for 1 minute, okay? I'll put it in this blog later, the China study, okay? And there are a lot of the China, Dr. T. Campbell has a lot of video, YouTube video actually, and you can go for it and just the China, China, CHINA study, STUDY, the China study. It's simple, right? So the point over here, it may be just right in between the tendon. It can be on the side, on that side, right next to the tendon, right? It can be on the other side. If you can't find any sensitive point over here, or even though you find some point over here, you also want to go up 1 finger and on the upper level and find any sensitive point. Again, 3 point, 1 at the middle of between those 2 tendons, and 1 on that side, 1 on the other side, and then you go lower 1 level, and for 3 point as well over here, same thing, 1 in the middle, 1 on the other side, that side, 1 on that side. Okay, so that is about 9 point over here. So as soon as you get to the sensitive point, you press on it and rub on it, press and rub. Okay, get this area, any sensitive point in this area, get rid of it every day. As I share with you, I have a friend, her mother, she's still in New Zealand because of the lockdown time, and she couldn't get back to China, and she had heart problem for years, I think over 20 years. and she was a teacher and very busy work, and she is on medication, you know, and she was so afraid to travel because I think that one time that she traveled over here and she got very uncomfortable and they have to go to emergency, and that is a a terrible experience for her. And now she was a teacher and she got a lot of student that is actually doctor in China and a principal of the hospital. You know, they are great, and some of her student actually in Japan, a Western doctor in Japan, in China as well. They are great. They always give her idea, and call her and ask her what's going on with her. Very respectful to this teacher. So I met her after a week. I met her. I say, look, I heard that you have a heart problem. I have some acupressure point I would like to introduce you to use, and you just do it every day. And this is the point. This is the point. I only show her one point. I only show her one point, and she did it for about 1 or 2 weeks, and she told me she no longer have chest discomfort. That's it. She said over the last 20 years, even though she was on medication every day, she still feel discomfort in the chest. It's not a big pain. If it's pain, she will go to hospital. But every morning she will feel it. A bit of tightness. It's not pain. You can't tell. It's just a bit of tightness. It's always there. Every day it comes. It comes and goes. Comes and goes. Now, only a week or 2 of massaging, get acupressure point over here, and it's gone. So again, if you put needle, if you're an acupuncturist, you find the point. In general, we just 3 finger and put it in the middle. Don't get that point. You want to try the 9 point. Get your hand to get to the 9 point and see which one is more sensitive, and put needle on it. Put needle on the most sensitive one. If there is the other point a bit sensitive, you can also put needle over there. As soon as you put needle there on all the sensitive point, they feel, oh, it's all gone. It worked immediately. Trust me. I tried a lot of time. Is it on both sides of the hand? Yes, you can do it on both sides of the hand, right? Normally we just do one side. Yeah, it works on one side. But for acupressure point, you want to get rid of all the sensitive point over here. Again, this is a tool for you for emergency use, and this is a tool for you if you suffer from CAD. You need to get rid of here. It's very good for heart, get heart function better, but treat the risk factor, which is all high cholesterol, high blood pressure, diabetes, obesity. How do you change all this? Change your diet. And another thing is stress. You need to get rid of the stress. You can't get rid of stress, but you have to reduce, you have to control. How do you control? If you do yoga, if yoga help, do yoga. If meditation help, do meditation. If singing help, sing every day. If go for a walk help, go for a walk every day. This is something that you have to do for yourself to save your life, right? That's it for today. If you enjoyed this live video, please share. So thank you for being here with me, and that's it for tonight, and I'll see you tomorrow. See you. Bye-bye. Stay awesome, and I love you all.